My dear sisters, distinguished delegates, good morning. It's with a heart full of warmth and, I must confess, and excitement that I wish to welcome you once again to Kigali for the 17th General Assembly of the Organization of African First Ladies Against HIV and AIDS. J'espère que vous avez passé d'agréables moments parmi nous et que vous avez pu prendre le temps de découvrir le patrimoine culturel et ces merveilles naturelles qui font, nous dit-on, le vrai charme de notre pays. We are pleased, very pleased, to have you among us for these few days. Chères sœurs, pour nous, la tenue du premier sommet de l'Union africaine sur cette terre rwandaise, aux 1000 collines, a une résonance particulière. Elle illustre à nos yeux un moment d'une portée historique et symbolique importante, tout juste 22 ans après le terrible génocide des Tutsis qui a contraint notre pays, notre nation à lutter de toutes ses forces pour restaurer la justice, la paix, l'unité et surtout la dignité de tout un peuple. Indeed, what we managed to do by rising up again is to us a symbol and testament to what Africans can accomplish and overcome when we foster the will to work together and walk the same path towards a future of our own making. You know, of course, that in the aftermath of the genocide, there were limited resources, means to answer our many priorities. We therefore had to be very strategic in pulling together human and material resources to help rebuild the lives of millions. Perhaps more importantly, we had to stay united and determined. We resolutely focused our hearts and minds and elaborated culturally sensitive legal, socioeconomic, and health initiatives to help our nation leave behind its darkest times. Distinguished guests, some of the initiatives that made a difference were directly inspired from OAFLA. You must all remember, treat every child as your own, which drew from our traditional African practices and placed the well-being of every child at the center of our communities. We successfully launched it in Rwanda after carefully adapting it to our cultural context. En tant qu'Africains, nous partageons beaucoup de ces réalités qui touchent la santé, mais aussi d'autres domaines sociaux ou économiques. Nous partageons également des normes culturelles qui s'inspirent de valeurs communes et d'un sens du devoir collectif. Ainsi, nous pouvons réellement appliquer avec efficacité dans un pays donné des solutions locales conçues dans un autre pays, tant qu'on prend soin de les adapter minutieusement. Esteemed ladies and gentlemen, as OAFLA is fast approaching its 15th anniversary, I cannot refrain from looking back at our early days to assess our common journey. I humbly believe this is to be an important exercise to help us embrace what brought us together in the first place, as well as evaluate the legacy we wish to leave behind, regardless of when we began to implement the different initiatives in our respective countries. As an example, we are currently promoting the theme, Advancing Sustainable Partnerships to End Paediatric AIDS and Improve Adolescent Sexual Reproductive Health and Rights. So this is a good time to pause for a moment and ask ourselves what we must do to strengthen health systems across the continent and what linkages will most effectively help us to do so. And even further, what kind of effective public-private partnerships we should embark on if we are to realize the ambitious goal of 1990 to end AIDS. Dear sisters, over the years, the Rwandan government implemented several programs to fight this epidemic, worsened by the 1994 genocide. Carefully selected interventions relied on the involvement of all actors in our communities, including peer educators and community health workers, trained to provide primary care and counsel on prevention and treatment methods. The aim was for our population to be able to access the services they needed, even if they did not seek consultations at health facilities. It's thanks to strategic public-private partnerships involving capacity building for healthcare professionals and awareness-raising campaign for prevention and treatment of the HIV virus that we saw members of our communities become agents of change and contribute to the significant 50% reduction of new HIV infections since 1994, the suppression of viral load in 82% of the treated population, a 78% decline in AIDS-related death over the past 10 years, and a 98% testing rate among pregnant women, followed by a free antiretroviral treatment for those testing positive and children under 5. As you are aware, in the past days, we also launched the All-in Adolescent campaign through a partnership with the Rwandan military hospital, which has joined efforts to prevent new HIV infections among our precious youth. Mesdames et messieurs, bien que ces chiffres soient encourageants et prouvent que des interventions pertinentes et soutenues sont incontournables pour réduire le taux de nouvelles infections et améliorer la santé des communautés, il est de notre devoir de poursuivre ces efforts si nous tenons véritablement à éradiquer cette épidémie d'ici 2030. Et pour que nous réalisons cet objectif, nous devons continuer à sensibiliser toutes les catégories de la société en portant une attention particulière à la jeunesse et aux femmes, car nous sommes conscients que de leur santé dépendra celle des générations futures. As I conclude my remarks, I would like to call on us, all dear sisters, to consistently assess and reassess our commitment to this organization, born of our duty to lend a voice to Africa's most vulnerable populations. We must continue to invest ourselves and all possible resources to live up to this mission. This introspective exercise will only help to ensure that OAFLA's current and future partnerships have at their core the best interests of the African people. It will seal our resolution to work towards the dignified living our people so rightfully deserve. I thank you for your kind attention and wish you all fruitful discussions.